Quadratus Lumborum muscle. The Quadratus Lumborum, also known as the QL, is found deep in the lower back region. This muscle has three distinct sections, which give it a crisscrossing and intersecting fiber arrangement. This muscle functions to stabilize the lumbar spine on the pelvis in the upright posture. The ability to remain upright is so critical to human movement that bilateral paralysis of the QL muscle makes walking virtually impossible. Let's take a look at the landmarks for the QL. We have the last rib, the lumbar vertebrae, and the iliac crest. The QL originates on the lowest rib and the transverse processes of L1 through L3 and sometimes L4. And it inserts on the iliac crest and the transverse process of L5. Contraction of the QL produces lateral flexion of the spine with the hip fixed and hip hiking or hip elevation with the spine fixed. The external oblique assists this muscle during lateral flexion of the spine, and the latissimus dorsi assists during hip hiking. The opposite side QL is antagonistic during lateral flexion of the spine. Clinical findings for trigger points in the Quadratus Lumborum muscle are as follows. Dr. Travell refers to this muscle as the joker of low back pain because it is very frequently overlooked as a source of lower back pain. Clients may complain of pain in the iliac crest, sacroiliac joint, buttock, and groin regions. They will complain of a deep aching pain at rest, but is excruciating while in an upright, unsupported posture. Because of this, you'll often observe clients using their arms to support their upper body while walking or sitting. They may complain of a sharp, knife-like pain in their lower back. Rolling to either side while laying is extremely painful, something the therapist should be aware of when the client is on the table. Coughing or sneezing aggravates their pain. Pain can extend into the groin and/or the scrotum. Chronic pain of this type frequently causes emotional depression and loss of vitality. Some factors that may activate or perpetuate trigger points in the Quadratus Lumborum muscle include automobile accidents, awkward lifting of heavy objects, stooping while twisted to reach for an object on the floor, putting on pants while standing, gardening, walking or running on a slanted surface, sleeping in a soft bed with a hammock-like sag, chilling of the muscle during sleep, and lower limb length inequality, where one leg is shorter than the other. Trigger points in the gluteus medius, gluteus minimus, and iliopsoas muscles are all associated with trigger points in the Quadratus Lumborum. A common misdiagnosis for active trigger points in the Quadratus Lumborum muscle is sacroiliac joint dysfunction.